Hello, I'm Dr. Sukalyan Purkayastha. I'm a neurointerventionist, and today I'll be talking about a particular disease entity called Carotid Cavernous Fistula. This is a very interesting disease because when you have a road traffic accident, sometimes the carotid artery, that is the artery of the brain, can get injured, and all on a sudden the eye can bulge out, it can look very ugly, it can be quite reddish, and this is how a eye can look like in a case of carotid cavernous fistula that you can see in the slide. Now immediately the patient rushes to an ophthalmologist, and the ophthalmologist in turn send the patient to us for the treatment, because neurointervention is the only way you can treat a carotid cavernous fistula. Now this slide shows the anatomy of the carotid cavernous fistula, how the fistula can form, how a carotid artery passes through a venous structure called cavernous sinus, and when there is an injury of the carotid artery, the blood crosses into the cavernous sinus and in turn goes into the veins of the eye, and the eye looks like this because of very high pressure in the veins of the eye. Now there are different types of the fistula. I am not going into the detail, as you can see in the slide. And how you diagnose it? You can obviously diagnose it clinically, but if you do an MR scan or a CT scan like this, you can find that there is engorgement in the veins of the eye, and then the next diagnosis you do by doing an angiogram, digital subtraction angiogram. And here is a fistula, direct fistula. There is a rent in the carotid artery, the blood crosses to the cavernous sinus and then into the vein of the eye. Now here there is an example where this is an angiogram I have kept you just to show how a fistula looks like, right? And how we treat it? We can treat by putting a balloon inside the fistula site, and this is how a balloon looks like. I'm showing you in the angiogram, and this is another angiogram, and this is almost like a magic. As you can see that, you can see the balloon and the whole of the arterial tree is restored after putting a balloon. So this is how we treat the carotid cavernous fistula with a balloon, and this is how the patient's eye looks like before and after the fistula. So it's almost like a magic, isn't it? Sometimes the fistula can be indirect. That means there is no direct communication between the carotid artery, but there is an indirect communication through many more small arteries. So here is an example for indirect fistula, and this is how the angiogram looks like in the indirect fistula. The very tiny arteries filling the cavernous sinus, as you can see here. And then in those cases of indirect fistula, we put platinum coils, like the coils we put to treat the brain aneurysms, in the fistula sac, and that's how we block the fistula. So this is again how the angiogram looks like after closing the fistula, the indirect fistula, by placing coils. And this is the example of the same patients where you can see pre and post treatment, how the transformation of the eye happens and how the eye becomes normal. So in conclusion, carotid cavernous fistula is a bad disease that can arise out of many etiology, but the most common is the road traffic accident, and the neurointervention is the only way to cure this disease. Thank you.